job.
Have you worked in a medical clinic before, monsieur?
Define medical clinic. What kind of a doctor is Dr. Kutter?
Is an experienced operator, cutting and shaping the penises of little boys.
Where is Dr. Kutter?
Dr. Kutter is in Africa on a business trip promoting our business. Fill out the questionnaire. Is that gum we are chewing, monsieur? Are you married?
I guess I'm dating this guy.
Oh, so you have a boyfriend. Is he circumcised?
I guess so. Who isn't?
I'll discuss your application with Dr. Kutter. If he approves, you can start immediately. Welcome back, Dr. Kutter. How was deepest, darkest Africa?
How deeply moving it was to teach those barbaric savages how to do a proper infant circumcision.
Oh, what have you got there?
In just over 24 hours, I performed over 600 circumcisions on them with a fairly good success rate. And working on them was the highlight of my career.
How exciting!
Those ignorant people had nothing. No drinking water, no sanitation, barely enough food. So you can imagine how important it is to circumcise them.
You're a great humanitarian, Dr. Kutter.
Now the men are 60% protected from AIDS, and the World Medical Association is setting up permanent clinics so that every African baby will get a good, tight circumcision.
A condom for life.
We have a lot to teach the other races about moral cleanliness and hygiene.
And a lot of money to be made, Doctor. A lot of money to be made.
Well, who have we here?
This is Miss Eunice Ewe. She's our new girl Friday.
Pleased to meet you, Edith.
Actually, it's Eunice.
Well, Eunice, I'm sure you'll appreciate how important our work is here, cutting and slicing and shaping the young penises of tomorrow.
Sure, Dr. Kutter. I'm here to help.
Dr. Kutter expects you start early on Tuesdays and Thursdays. That's the day he has the assembly line.
Assembly line?
That way he can mix as much money as he can and get all the circumcision over with at once. It's a lot of screaming.
Are the babies in pain?
This is not a job for a weak-minded girl, Miss Ewe. I'm sure you'll get used to it. That's the topical anesthetic. You are to instruct the parents to slather it on before the circumcision. Then when the baby screams, we can say to the parents, oh, I guess you didn't put enough on. That way, it's their fault if the baby feels pain.
It says here not to put on the genital area and not to use on children under 6 months.
I am sure if there was any real danger, Dr. Kutter wouldn't be using it. But we are here to help Dr. Kutter, not to question his authority.
So, where is Dr. Kutter?
He's at the bank.
This is a pretty nice office.
You should have seen the other office. Compared to that, this place is a dump. But there was the glory days of circumcision, when a few drops of carbolic acid to the clitoris would tame a naughty little girl.
Ouch! I'll be good.
Eunice, put the chart up so Dr. Kutter can see how the business is going.
Excellent.
That's sideways, Eunice.
Those damn anti-circumcision activists are spoiling our business and our fun. We've got to do something to bring in new customers. What do you think, Snippit?
We had success with the baby magazines until the other advertisers started pulling out.
I'm thinking about a new campaign, something really catchy to make circumcision fashionable again.
At the last place that I worked, lots of girls were getting Botoxed.
That's it! A new look for the new mom and a new look for the new baby too. A total makeover for both mother and baby. We could even sell Botox to the dads to make them look more like their new baby.
Free Botox with every infant circumcision.
Not free, Snippit, but half the regular price. Once the new mom gets a needle stuck in her face a few times, she won't mind me sticking a needle in her son's penis. See what some fresh blood brings to the business?
We could get some new brochures printed up with gold ink to make it look classy and valuable.
Get a new picture from the stock photography company of a really happy baby. We need to sell this idea of a happier, kinder, gentler circumcision.
It will be like the old days when circumcision was not even questioned.
Was it really better back then?
Indeed it was. No need for consent forms, just cut, cut, cut.
And we could use any excuse. And we used them all.
We had a 95% success rate and the money just flowed in.
And nobody talked about human rights.
I'm tired of human rights.
It's those damn anti-circumcision activists.
Oh, poor Dr. Kutter, you're so tense. Would you like a back massage?
No, I don't want a back massage. The foreskin serves a purpose in utero and during the first week of life. After that, it poses a serious health risk to the owner, and the best thing we can do is to cut it off without the owner's consent. And now, Kutter Clinic offers infant circumcision at half the price of a hospital circumcision. With every penis reduction operation, you will receive a handsome set of 8x10 glossy photographs of your baby being circumcised. Be sure to order extra copies for friends, grandparents, business associates, and neighbors. Kutter Clinics are able to provide circumcision at an extremely low price due to our assembly line technique.
Sign the consent form today, before your baby's even born, and make sure your baby looks just like daddy.
Kutter Clinic is not responsible for surgical mishaps, poor cosmetic results, skin tags, pitted glands, degloving, buried penis, clamp injuries, post-traumatic stress disorder, unexpected aggression, hairy shaft, hepatitis, neuroma, night terrors, brain damage, measles, stenosis, medial ulcer, penis scrotal webbing, excessive scarring, skin bridges, infection, hemorrhage, cutaneous fistula, gangrene, loss of glands, loss of penis, parental regrets, or loss of life.
Are you good with plants? Dr. Kutter loves this plant, but it's not doing so well. We plant baby foreskin there to fertilize it and ask good luck for the babies, but it's just not doing very well. Kutter Clinic. Oh, Professor Mandrake. He's just walking through the door.
I'll take it in my office, and I don't want to be disturbed.
Who's Professor Mandrake?
Boris Mandrake is a circumfascist from the University of South Africa. He wrote a glowing endorsement for Dr. Kutter's book.
Boris Mandrake, how are things down under?
Well, if by that you mean how did my most recent circumcision go?
How many circumcisions have you had now, Mandrake?
This is my second, and I feel better than ever.
How are things at the Acorn Club?
I'd rather not say too much over the phone, but we've had a couple of new recruits who are very eager. Some are ready to go all the way.
Good, good. Once a man knows how great sex can be with half his penis skin gone.
You've got to give those parents who won't circumcise a good talking to.
Those damn anti-circumcision activists. They're spoiling all our fun.
Mark my words, Kutter. Africa is the new frontier.
I wish it were that easy. Here they're all lily-livered, bleeding heart sissies, bloody hippies. They'd rather have their son risk getting a urinary tract infection than give up half his precious penis skin.
Don't worry, Kutter. You know me. I won't stop till there's mandatory circumcision worldwide.
I appreciate your enthusiasm, Mandrake.
How are sales of your new book going?
Well, I managed to give away 3 copies so far.
3 copies? That's not so good. I thought this was going to be a bestseller.
It's those anti-circumcision activists.
Did you see the movie?
What movie?
The Holy Foreskin.
A man of my stature can't be seen going to a movie like that.
Oh, come on. There might be some good cutting scenes.
Shh, quiet, Mandrake. You don't know who might be listening.
Get those file boxes